On this episode of WarDocs, we welcome Colonel Dr. Elizabeth Erickson. She shares her journey into Air Force medicine, highlighting her experiences in global health engagement and the importance of cultural sensitivity in international health initiatives. She discusses her overseas assignments, pivotal experiences in Afghanistan, Europe, and around the globe, and the challenges of collaboration in multinational health missions. Dr. Erickson discusses her role as the director of the Center for Global Health Engagement, emphasizing the importance of global health engagement in preventing conflicts and crises. She outlines various training and education programs aimed at enhancing global health capabilities, shares lessons learned from her experiences in Ukraine, and highlights the significance of health diplomacy in fostering international cooperation. Dr. Erickson also addresses the role of technology and AI in strengthening global health security and the barriers to effective collaboration among nations. For further information about Dr. Erickson and our previous guests, visit our website, wardocspodcast.com. Be sure to follow WarDocs on your preferred podcast platform and subscribe to WarDocs on our YouTube channel. I'm your host, Dr. Doug Soderdahl, Army Urologist.
Welcome to WarDocs, the military medicine podcast. This show brings you a first-hand, behind-the-scenes look into the mission, unique opportunities, and deployed experiences of the entire military healthcare team. From state-of-the-art hospitals in the United States to the most austere environments across the globe, WarDocs has you covered.
Today we're privileged to welcome the director of the USHU Center for Global Health Engagement, Colonel Dr. Elizabeth Erickson, to WarDocs. Liz, thanks for joining us today.
Oh, thank you. It's such an honor to be part of the podcast and really appreciate the opportunity.
Well, why don't we start off by you telling us a little bit about your pathway into Air Force medicine and why you chose to initially specialize in family medicine?
Sure. And I guess before I start, I should just put a brief disclaimer out there that any views or opinions I express are mine and mine alone and don't represent the DoD, Uniformed Services University, or the Air Force. I grew up in the great state of Minnesota and kind of in high school decided I was interested in medicine. Went to St. Olaf College, which is a little small private liberal arts college in Northfield, Minnesota, strong in pre-med and also strong in study abroad programs, which was of much interest to me as I headed into college. I kind of set my eyes on a program in India that was a biology program, really had a lot of health into it that I ended up doing my senior year, but through the years then kind of was looking at, okay, I want to go to medical school, but I know I want to do things in the international space. And I suppose probably like many, I wanted to be debt free, as soon as possible. So I was looking at ways to reach that goal. An Air Force recruiter came to St. Olaf College. That was the only service recruiter that came, and so I got introduced to the Health Professional Scholarship Program, and started down that pathway. In fact, then I think I was in India on this study abroad program as I was working through finishing the applications and things like that, and applying for medical school. And so that just kind of set the pathway into Air Force medicine. I did take a year off between college and medical school, and did some more time overseas. Went to East Africa and did some volunteer work. That was nice to kind of follow on from my semester in India, and so that kind of ties into where my interests were, really even before I got into the Air Force. So medical school, the University of Minnesota, and there as well, looked for opportunities. Was on a students' international health committee, I think at the time, and then getting my Air Force. Month at a time opportunities to kind of get a little bit exposure to what I was heading into. I knew really almost nothing about the military, but went down that path, and was kind of intriguing. This all was kind of the late 90s. I was in medical school when 9/11 happened. As I pre-commitment to the Air Force, my recruiter said, "Oh, we'll never go to war, and you'll never deploy, and you just do your 4 years and move on." And so that, I guess, to be honest, was kind of the plan. Kind of do that 4 years and carry on with my life and do international things. But here I am, 21 plus years of active duty. Just have really enjoyed it in Air Force medicine. Family medicine, I think in medical school you just kind of find your tribe, and the family medicine community, I think, was where I felt the most at home. Having a significant interest in global health, international health, I thought about internal medicine and infectious disease, and but I really enjoy kind of the broad spectrum of family medicine. For myself, I found that I enjoyed the clinic setting more so than the hospital setting. The prevention emphasis of family medicine appealed to me from early on. So that's where I headed. Went to Travis Air Force Base for family medicine residency. Had a great experience there.
So early in your career, you had the opportunity to serve in overseas assignments, both in Turkey and in Germany. Tell us a little bit about how those experiences influenced or shaped your career trajectory and got you even more interested in global health engagement.
Well, it was interesting that I ended up with Incirlik Air Base in Turkey as my first assignment outside after residency, because I recalled when that Air Force recruiter had come to St. Olaf College and had the map of where the bases are. I kind of went, "Oh, Turkey, that sounds interesting." So yeah, I was almost 2 years at Incirlik. We were really sharing a base with the Turkish Air Force. We have to interact with the Turkish medical community quite a bit as our patients, are sometimes seen, downtown. I think it just gave me a different cross-cultural experience from those that I had had before. Additionally, I had a deployment while I was stationed there to Mali, where we were doing, it was a small Air Force team that went along with special operations forces that had been back and forth to Mali multiple times. And that was really one of my kind of first operational global health engagement, I suppose, if we didn't call it that at that time, but one of those first experiences that certainly helped me understand some of the operational impacts broader than the medical piece, and exposed me also outside of the Air Force to special operations, and learned a lot. It was a short deployment, but kind of impactful, from that assignment. And then was looking to stay overseas, not surprisingly, I suppose. So had the opportunity to go up to Ramstein, and my tour of Ramstein, I feel it was kind of two short tours separated by a sort of long deployment to Afghanistan. So the time at Ramstein was a little bit more internally focused, clinic doc taking care of our population there. But certainly my deployment in the midst of that to Afghanistan on a provincial reconstruction team was really a pivotal experience in my career.
So what would you say is really vital kind of training to get to be prepared to do things in the global health engagement space? You had family medicine, background. You got more training in public health. What do folks need if they're interested in doing something that you're doing now?
Yeah, well, I think there's a lot of different kind of levels at which you might work within the global health engagement space. And really, global health engagement is quite a wide array of different programs, different authorities for engaging with our allies and partners. Maybe that you're going on a exercise, with other nations. You might be part of a subject matter expert exchange that might be focused on something you've got particular expertise for, or you might be in a full-time role where you're responsible for planning and working through how your global health engagement operations or activities initiatives fit into broader strategy. I think for all, having that cross-cultural awareness, coming in with humility, sensitivity to understanding differences in those environments that you're in, working through communication, and that it doesn't mean necessarily that you need to fully be fluent in the language of the country that you're engaging with, but taking steps to learn a few phrases that really show that respect. Learning how to work with an interpreter. Those are some of those key tactical skills. And then as you kind of move up into other roles where you might be doing the planning piece, I think that gets into, you might need to understand security cooperation, which is kind of a whole nother world that you've got a lot to learn to work within that space, and in a command wherever you might be at a component command or combatant command. And so it really is a spectrum, and that's something in my current job that we're really looking at. What kind of training is required, is value added through those different roles that people might play in global health engagement.
Let's talk specifically about some of the roles that you've had. And one that kind of caught my attention was that you served as a senior medical officer and chief of women's affairs on a provincial reconstruction team, Zabul, Afghanistan, in late 2009, 2010. How was that experience in shaping your approach to integrating cultural sensitivities in global health initiatives?
I mean, that experience was really pivotal in my career. And I, I had tried to volunteer for that deployment a couple times before I and then got short notice tasked. So it was really, for me, enjoyed having that opportunity to work across the US government interagency, as well as with our partners that were also operating in Afghanistan, uh, to help support the local government, the provincial government, in that particular area. You know, the PRTs or provincial reconstruction teams were a pretty unique unit, and we really built relationships with our Afghan partners to get after building trust and confidence in the local governance, helping to support infrastructure, clinics, schools, etc. I had the benefit of my predecessors in Zabul province that worked the medical programs, really being leaders in the not what we now call global health engagement field, that took an approach of uh, we're not going to come in and do. We're going to enable that local community to implement these programs. We had to have a close partnership. We had to have that buy-in of the community from kind of the ground level to the governor. And where we sat, our fob was right next to the governor's residence, and we went back and forth, all the time as we worked through planning things that we were working on. So some of the projects that our provincial reconstruction team implemented, one was called Strong Food. So it was a bit little somewhat similar to product called Plumpy Nut that is used more globally. That takes it was almond based. Brings in some key nutrition elements into a nutritional product, if you will, that for children with malnutrition. And so we worked with the local health department so that essentially, they employed folks that prepared the strong food product, and then we worked with one of the doctors to monitor the children that were utilizing that product. We had a clean water program. Instead of doing sort of the traditional medical civic action program or MedCap, that oftentimes is kind of seen as sort of traditional engagement opportunities where we would maybe go and provide care. We were supporting team from within the province to go out to those communities. They were much better equipped to care for those patients in those hard to reach areas, and feel that linkage to the provincial government. I also was able to work closely with the women, and I think that really was a unique opportunity. We had three women on our team. We were all on the whole PRT, and all of us were in the medical team. And we really built strong relationships with the women that worked in the provincial hospital, and also some of the district hospitals. We did some training programs on basic life support for obstetrics, and looking at kind of what their challenges were and how we could assist. Also worked to build a nurse midwife program. We worked very much with the girls school in town that was well supported, and we had great partnership with the principal of the school. So all of those efforts, really to do what we could to kind of help with stability and support to the provincial government. An enormous amount of lessons learned from that, but again, kind of coming back to respect, humility. There were a lot of things where we could build those personal relationships that helped to build partnership and for us to do things closely together, and then learning how to work interagency. So across the U.S. government on our PRT, we had folks from Department of State, U.S. Agency for International Development, U.S. Department of Agriculture, all these different elements where we could find where there was common ground across our different programs and try to work to best effect. So really a pivotal experience for me at that point in my career as still a relatively junior major.
So now that America, the coalition troops are completely out of Afghanistan. Do you ever wonder what happened to those programs that you were involved in, or get any follow up?
Back, a few years ago when the initial withdrawal happened, I did still have some contacts with some of my Afghan colleagues, some on social media and things like that. So was able to kind of follow their stories and their efforts, in many cases to get out of the country. I know the girls' school that we worked with was able to keep operating for some time. There was actually a news article kind of around that late 2021 timeframe, but unfortunately, limited and ability to know what's going on at this point. So we poured our hearts and souls into that deployment mission 15 years ago. So it was certainly was hard to watch what was happening in August of 2021.
So you've had multiple deployments. Are there any interesting cases or situations that stick out that you encountered and you want to tell us about it and how you dealt with it?
Sure. So certainly not as many deployments as many of my military medical colleagues. So kudos to those who have gone again and again. Mine were a little bit fewer and far between, but as mentioned, I went to Mali on a short deployment in late 2006, and there I'd say learning opportunities. We were there, with an 18 Delta assigned to that team, and so really opened my eyes to what we now call tactical combat casualty care, TCCC. So learned quite a bit there. That was, maybe the most impactful operationally for me. But we did, do these health outreach days in a few different communities, and certainly saw a lot of cases, things that I wouldn't see in my normal practice, most of which a little bit challenging because there wasn't a whole lot that we could really do for that and with a limited scope of what we had. However, we were able to build relationship, really by way of that 18 Delta who had been multiple times down into that community in Timbuktu, um, and try to align folks to getting care in the local facilities. My Afghanistan deployment, I mean, thankfully, we didn't have any significant, combat losses or major combat casualties. I'm a prevention person, so I probably my most impactful memory, in January of 2010. I was in a vehicle that we had an IED as we were coming back from a mission, and we were in an MRAP, thankfully, because had we not been in an MRAP, had we been in a Humvee, I probably wouldn't be here today. Working through that and being in the unique position of after that when we went to the larger fob that was nearby and met with the Ford surgical team that was there and got all of our evaluations. I was sort of a patient, although really I was fine, but then kind of checking on everybody and taking care of the team as well. And then when all was said and done, we got back to the fob that evening. There were a lot of people that had been in the vehicles behind us, that were really kind of having a rough time. And I think for them, they saw it. We were inside the vehicle, we didn't see it. So for me, I just pressed on forward. Whereas then, kind of needed to be mindful and take care of those teammates, that had some stress related to that. A few other things, we were a pretty big medical team. We had seven of us, three providers and four medics for a team of about 100, because our primary mission was really more that PRT, that engagement piece. But certainly we provided care for the team. So there's some notable kind of primary care type things from that time that have stayed with me throughout my career. I think in the interest of privacy, I won't go into too much detail, but certainly being in that operational environment, being your team's doc is an experience like none other, when you're kind of living and doing the mission together every single day. And then you're trying to make sure everybody's, as healthy as can be.
So in 2012, you worked on the Pacific Air Force's Commanders Action Group. And a lot of times I think that, medical folks kind of get just focused in on the medical problems. But how in that role did you kind of figure out, hey, there's a bigger picture going on beyond medical? And, after that, you went on to PACOM, now known as Indo-PACOM. How did that help you?
Yeah, so that was a unique experience. I had gone to PACAF in 2011. Actually, I was 13th Air Force at the time, but merged into PACAF in 2012, and actually it was General Paul Friedrichs, then Colonel Paul Friedrichs, was the PACAF surgeon at the time, and in fall of 2012, he called me into his office, I think on a Thursday, and said, "Hey, you're going to go interview for this job," and I think I started working there on Monday or Tuesday the following week. So I said, "Hey, you're going to work on the Commander's Action Group, the CAG," and at first I'm like, "What is that?" It's a support function to the four-star commander and then the other senior leaders for Pacific Air Force. And I had the opportunity to, some of my duties included reviewing and putting together trip books for General Hawk Carlisle, the PACAF commander at the time, or some of the other senior leaders. We were kind of monitoring calendars, synchronizing who was engaging, with various stakeholders. But I got to, be in the room a lot for things that I probably wouldn't have otherwise for senior leader meetings, but also, some engagements with, visitors and with other stakeholders. So definitely for me, being the only medical person in that group of, I think we were 6 to 8 folks that were doing that function, I was out of my comfort zone, but learned so much and really understood what was on the minds of those senior most leaders. And yeah, I was meant to be in that role for a year. Kind of circumstances worked out that I was able to move up into to PACOM, or now Indo-PACOM, into the surgeon's office. So just moving from that component command up to the combatant command, understanding that bigger picture, what are the strategic priorities, and then also having been at the component and moving up to the joint combatant command. Helped me kind of understand, okay, what falls in the realm of different components, right? So different components are going to have different pieces of the overall strategy and campaign plan that we're getting towards. So I think it made me a better officer, certainly. Definitely were some lessons learned coming from a medical environment into a line side environment, but suited me well for multiple future staff assignments.
So you mentioned joint, and sometimes it's just difficult getting the Army, Navy, Air Force, Space Force to work together. But you've also had experience working with NATO, international entities. What lessons have you learned about how to foster effective collaboration in really complex multinational health missions? I mean, does each country think they know how to do it, and the other people don't? How does that work?
Starting with the joint environment, sometimes that's the hardest part, right? Just to get over our service specific parochialism. But I mean, no, really, that breaks down pretty quickly, that you're just one team. So my combatant command assignments, really working at the joint command, have been really my favorite, because we all just bring different things to the environment and to getting the work done. Yeah, and then moving on to, combined environments, multinational, certainly brings another layer of complexity. However, I think it also brings some fun. It's really enjoyable to work with so many, different allies and partners. I think maybe most recently has been my most intensive multinational experience. So this year I had a 6-month deployment to Germany to be the surgeon of the Security Assistance Group Ukraine, which then they stood up a NATO organization, the NATO Security Assistance and Training for Ukraine, in the period of time that I was there. So, working with a group of, really, there were 27 countries, in this coalition that was part of the Security Assistance Group Ukraine and the International Donor Coordination Center, was wild, really. But you figured out ways to best coordinate, and how can we best work together to support Ukraine. That was, the main mission. And so, you know staff structures allow for that coordination. On the medical side, we set up coordination mechanisms. We had, monthly meetings. We had a particular training working group where we bring all the different stakeholders in. I think having those structures in place and kind of setting more or less some rules of engagement as to how we do that coordination is critical. But then really there's the kind of interpersonal communication, respect, and understanding the different maybe constraints and different priorities that might come into play. Uh, Sometimes there's really understanding some of the nuances with that. So you're optimizing that multinational coordination. Certainly, I don't have it figured all out, but I love being in environments where we're trying to get after that, where we're a coalition to work towards a strategic or operational goal.
So, in your current role as the director of the Center for Global Health Engagement, what do you see as the most pressing challenges in the DoD's, you know, global health enterprise, and how specifically is your center addressing those challenges?
Yeah, so I'm in my second month here as the director of the Center for Global Health Engagement.
So you
I
haven't
did
haven't solved it all yet?
I did work here in the center before for a year back in 2018 to 19, and really have been a partner of the center since it began in 2016. I think for the global health engagement enterprise broadly, we really need to most effectively utilize global health engagement to support a couple key things. So there's support to deterrence, and I think of deterrence. I'm a preventive medicine doc too, so it's kind of that preventing conflict, preventing crises, preventing outbreaks and things like that. So work in that space, and then being also ready to fight tonight to prevail in conflict should we go down that road. We do a lot of global health engagement work across these spaces. We could do better to make sure that they're strategically aligned, and that takes coordination and integration across all the different combatant commands. We're working through as a community some policy updates, some best practices for knowledge management, where we're sharing information. How can we do the most with what we have available? Because resourcing for this global health engagement mission sometimes can be a challenge. Finally, I think. Going back to the working within a coalition and with allies and partners, we really have to do better at coordination with those allies and partners. I mean, my experience kind of support to Ukraine was very specific, but if we're looking sort of more global, many of our allies and partners are doing somewhat similar work. And so, where can we partner? Where can we find efficiencies to get after work that gets us towards interoperability, being ready to operate together, and also that continued work for preventing conflict. So working in that competition space, how can we prevent us from going into that large scale combat operation environment?
Now, does the center have training and education programs that you run, and what are they? How can people, sign up for them, and how do you prioritize what's important?
Yeah, for the center, training education is one pillar of the activities that we do, and really in support of the whole DoD enterprise. So we have a few courses that we run specifically from the center, and they kind of run a gamut. So we have a online training course called Introduction to Global Health Engagement. That's on the JKO, Joint Knowledge Online V class platform. So that's about a 3-hour course, just really introductory. So people are just not even familiar with what global health engagement is. That's a good place to start. We do the fundamentals of global health engagement course. We do those virtually about once a month, and folks can go to our website and sign up for that. That we really capture a pretty broad audience with that course, virtually over 5 days. We sometimes deliver that in person too, so we might have particular units or combatant commands that ask us to do that. And then we have the global health engagement operations course, which we just executed last week. That's really aimed at personnel that are in that those planning roles that are planning and executing global health engagement, so working perhaps at component commands, at combatant commands, also might be at security force assistance brigades, air advisor units, those sorts of things. So that gets a little bit more into the operational planning space. And then once a year, we do a course called Global Health Strategies for Security. That's a little bit more of a symposium seminar. But then with the university Maine, and especially with our partners in the Preventive Medicine Biostatistics Department, we support Masters of Public Health, and various other graduate degree programs with content that is related to global health and global health engagement. And we support the medical students, the Graduate School of Nursing students that during the Operation Bushmaster exercise. So we have a particular training lane within that where we help to develop some of those skills, some of those cross-cultural communication, a little bit of planning skills to help those students be prepared as they're finishing up their medical and nursing training. So kind of a spectrum. And then excitingly, we're partnering with the NATO Military and Medical Center of Excellence on a NATO military global health engagement course, and that's also in partnership with our UK sister centers, the Center for Defense Healthcare Engagement. That we're just launching. We're going to do that in February. That we're partnering on that course, and really excited to broaden out to engage our allies and partners in our training courses more. We also host students, so medical students doing a capstone project, graduate students doing MPH projects, practicums, things like that, so that we can give them an opportunity to maybe do a research project or some other kind of project that's going to be relevant to future potential roles in global health engagement.
So you mentioned a little bit about your recent real world example of, serving as surgeon with a security assistant group Ukraine. Was there anything there that you said, boy, there's a gap in our educational training plans, or, something that we're missing that you're bringing back to the center now that you just had, kind of boots on the ground experience? You say, hey, we need to focus a little bit more on X, Y, or Z.
Yeah, well, I think it ties into real world considerations right now of being ready for large scale combat operations. The Ukrainians, 1,000 plus days since the full scale invasion, and they've been under in those combat environments that we potentially could be seeing in the future. So number one is learning the lessons from our Ukrainian partners, and they're very, very willing to share those lessons, learning them, but then incorporating them into our own doctrine. And so I think that's where GHE. So we're doing things with the Ukrainian where we're bring understanding those lessons learned. We're also supporting them with training and equipping, advising, assist, those sorts of things. But it needs to translate to then our own, updates to policy, doctrine, et cetera, both for the U.S. and NATO more broadly. The unique situation with engagement and support of Ukraine right now is their ongoing, you know, uh, fight, near term fight, but then they're very much forward looking and trying to work towards really NATO standards. And so, how can we assist them in those long term goals while also, trying to assist them in making sure that they can, fight today? We learned just in the brief time that I was there looking at equipping. um, they've been in this combat operation now for quite some time, where they're getting donations from all sorts of different entities, different countries, that are non-standard. And so one of the things we had been working towards is, can we develop a package in partnership with what the Ukrainians say, hey, these are our requirements, develop a standardized package, so then if a nation is looking to provide that support, it's kind of ready off the shelf and the Ukrainians would know what they're getting. So I think packaging standardization is an important way that we're moving forward with support to Ukraine, and we need to think about that kind of for our own experiences going forward as well. The other piece would be training. So we had a lot of focus on support to training, mostly in that kind of TCCC aligned space. So all service member within basic recruit training, those sorts of things. But then combat lifesaver and combat medic course. So definitely those two courses. We put a lot of coordination efforts into making sure it was standardized to what the Ukrainians prioritized to be at those levels of training. So we worked through updated training directive for that combat medic course with the Ukrainians to understand all the skills in alignment with their policy that they had just published that would be included in that course, which doesn't necessarily match exactly up with what we consider tier 3 TCCC. And so having that kind of flexibility and understanding in the operational environment where you just can't take 12 weeks to train a medic, what are those key things that we need to focus on if we have 6 weeks to get those combat medics trained up. So that was something we're working through, making sure there's kind of a spectrum of courses that were aligned to the Ukrainians' requirements, and that potentially could change in the future if they got back to a steady state kind of environment. Okay, then they have some breathing room, and how can they go back to a longer training pipeline? So I think all of these things are really important for us to consider for ourselves. Should we be in a large scale combat operation environment?
So it does seem that we focus a lot on how medical diplomacy can play a significant role in conflict zones like Afghanistan, Ukraine, Iraq, Middle East. But how is it important in like you just mentioned, that non-conflict, steady state time around the globe? Maybe the country's not on fire actively. How has your experience influenced, your broader strategic priorities and outcomes?
Yeah, so I think if we talk about health diplomacy, it's important to kind of structure it in the what we call the 3Ds alignment, if you will. So looking at the defense sector, the diplomacy sector, which Department of State is going to be lead on, and the development sector, which U.S. Agency for International Development would be lead on. In the defense space, in health, then we're going to interface with both of those other 3Ds, and really, if we're all together and working towards similar goals, we're going to have the best effect. A few examples from my own experience. So I worked at what's now Indo-Pacific Command 2013 to 16, and one particular country where health diplomacy, I think, really led to greater cooperation in the defense space, was in Vietnam. So in the 2000s, kind of late 2000s, really sort of working to reestablish relations with Vietnam, and medical and humanitarian assistance type engagements kind of set the foundation for that. So things like Pacific Angel that the Air Force executed, Pacific Partnership on the Navy side. So we saw, that those doors kind of opening, and within the embassy there, a number of programs, things like the PEPFAR, the President's Emergency Program for AIDS Relief, and there's a DoD portion of that. So we had a mission for the Defense HIV/AIDS Prevention Program, DHAP. We started kind of doing some coordination on research cooperation, and now the Navy Medical Research Center has now well established ties with Vietnam in that space. All of these relationships kind of began in medical. My own piece in that 2012, early 2012, I was still working at PACAF, but PACOM, the surgeon at the time, Admiral Bono, needed someone to help assist her on a trip that was to multiple countries. But we went to Vietnam, met with the Surgeon General, met with the country team and the embassy. We kind of ensured we were all on the same page as to what some of our goals were in increasing our cooperation, that were really aligned to some of the embassy goals to build cooperation. Later in 2012, I had the opportunity to assist with a visit by Vietnam Air Defense Air Force officials to Ohio, to Wright-Patterson Air Force Base and the Air Force School of Aerospace Medicine, also to Washington, D.C. And it was the first visit to the Pentagon by Vietnamese officers, really, since before the Vietnam War. Continuing on, 2015, we partnered with Vietnam, hosted a large multinational event, the Asia Pacific Military Health Exchange. Just ongoing partnerships that really broadened out the cooperation. The other piece, that I fit into the broader perspective. We began doing bilateral defense dialogues between the U.S., led by Indo-Pacific Command, and Vietnam. So medical having a seat at that table while we work through. Here's some things that we want to cooperate on. Moving forward, 2015 to 2018 or so, the U.S. as well as the U.K. supported Vietnam as they built up UN peacekeeping operations. So then they really became an exporter of security. So they deployed to South Sudan, and we had assisted in their developing a capability, a role to UN level 2 capability, and then outside of just the medical space, more and more. Defense cooperation, security cooperation, more on the line side. And I think 2015 or 16, you had a carrier, come to port in Da Nang for the first time in more than 50 years. And so that's just one example of where really medical was kind of that foot in the door. One other example, maybe from my UCOM time, there's an organization called the Balkan Medical Task Force that's six Balkan nations that in 2011, at kind of a multinational security forum, it was determined, hey, we need a way to kind of bring some of these countries together that had emerged from post Yugoslavia and all the changes that had occurred there. What can we do, to bring these nations together in cooperation? And medical, was the way to do that. The U.S. and Norway helped to assist these six different nations come together and develop basically a role to field hospital capability. That was, really about those diplomatic goals. Medical was the platform by which those countries were routinely getting together for these executive steering boards, for these planning meetings, and it took years to get to a signed agreement for this Balkan Medical Task Force to be institutionalized and then be able to provide a medical capability were there to be a disaster, or they're also looking towards potentially supporting UN peacekeeping operations or perhaps NATO missions as well. Definitely, that was a health diplomacy effort where I had the opportunity to go side by side with my J5 colleagues at UCOM, so our policy and plans folks, to help kind of move this effort along forward. And we really just kind of in an advisory role as that Balkan Medical Task Force, those six countries, really hammered out the details to have this successful cooperative partnership going forward.
So one of the hot topics that we see that's changing the landscape of medicine, in America, across the world is technology, telemedicine, AI. What are some of the promising innovations that you've encountered, maybe dealing with technology that could strengthen global health security?
Numerous, right? So if we talk about global health security in kind of the traditional sense of biological threats, there's so much that we learned, I think, through COVID to be able to rapidly scale things like surveillance. Development of vaccines, development of testing capabilities. I really think it's critical that we keep those technologies kind of fresh and ready to go should we have other incidents. I mean, I think we're even seeing that those platforms are coming to bear as different potential threats kind of pop up. From a AI standpoint, I think there's uh, much that we can potentially gain by utilizing AI to help with management of a lot of data. One of the things that I think we struggle a little bit with in global health engagement, global health security, is just data management, information management. How can we make the most impact with the information that's available in order to make decisions, to inform leaders. So I know that's something that is really a priority for our president of Uniformed Services University, Dr. Woodson, and we're looking at some ways to use those AI tools, large language modules, to help support knowledge management, information management, dissemination of information in the global health engagement community, and then watching kind of what many of our partners are doing in the space. Innovation wise. So you had JP Chrétien on from DARPA not too long ago. I mean, amazing things that they're working on there. And I think those can only be strengthened by looking for opportunities to partner with other nations, as well as kind of across interagency in the US government, public private partnerships, working across academic institutions. So many opportunities working towards being strategic to utilize those technologies to get at strategic imperatives is really important.
So what are the roadblocks that are keeping the evolution that you're foreseeing from happening, and what can we do to overcome any of those barriers?
Um, Meaning the evolution in
Like, you
people.
see what you said, well, in 5 years we're going to have, this technology data, and where you see ourselves going. Is there anything that is a barrier or a roadblock to getting from X, where we are now, to a future state where we want to be in 5, 10 years?
Yeah, so I think some of the barriers are our ability to share information with our allies and partners, and develop agreements with our other countries so that we can easily operate together. There's a lot of kind of challenges we face, you know, just systems wise. So a little bit coming back to my recent experience with SAGU, then transitioning to a NATO organization, and the I think the hardest piece to work through was how are we going to communicate, what email systems, what platforms, how simply how are we going to communicate with each other, and then I think access to these different data management systems that oftentimes are in a classified space, and so there's a whole lot of work that must be done to be able to make things easily shareable with our partners. So I think that that's a big piece, is overcoming some of those communication systems barriers and ensuring that we maintain security. We need to appropriately classify things, but also as much as possible make things shareable amongst our allies and partners.
So I suspect there's going to be, several viewers or, listeners that are going to go, man, this global health stuff sounds pretty cool. Um, what advice would you give to a young healthcare professional who really wants to learn more and get involved in this type of work?
I tell most people, make sure that you make your interests known. So letting your supervisor, whatever setting you're in, letting folks know about your interest, because sometimes things will kind of pop up, and there might be opportunity for an individual tasking, or you might be able to go out on a mission, that sort of thing. So number one, just making your interests known, finding opportunities, interest groups, things like that. I mentioned way back long ago when I was in medical school, there was in my civilian medical school, there was an opportunity for a committee. I know here at the university, there's a, interest group. So finding those opportunities. I'd say for folks that are at the military treatment facilities, if you're in a CONUS MTF, maybe it feels like there's not a lot of opportunity for global engagement. However, in the US, there's a lot of communities where you can get that cross cultural experience, and just learn about other people's other cultures. Depending on what service you're in, there are different programs that can set you on a trajectory for work in the global health engagement space. My last job, I led the Air Force's International Health Specialist Program, which is almost 25 years old. So that's a program by which people can get a special experience identifier, and then we have about 60 some full-time positions that work in global health engagement at components, combatant commands, also the Defense Institute for Medical Operations organizations that sends out training teams. On that note, Defense Institute for Medical Operations, or DEMO, they send out courses to other countries primarily. They also host some in-residence courses, and they maintain a roster of volunteer instructors. So you can volunteer if you have particular subject matter expertise that matches with some of their courses. You could volunteer to be a potential instructor. On the Navy side, they've got the Global Health Specialist program, and there's a pathway for that. In the Navy, that's open to officers. Taking a step back, on the Air Force, the International Health Specialist Program is open to officers enlisted of any medical AFSCs, Air Force Specialty Codes, and also active duty, guard, and reserve. The Army has a special identifier for their veterinary corps, and are kind of making some movements toward a broader special identifier. So those are kind of the formal methods that you might get kind of into a career pathway for global health engagement. Keeping an ear to the ground for different opportunities that might arise for volunteer work. If you're OCONUS and an MTF, oftentimes there's opportunities to engage with the host nation. And so all of that can be value added to learn. And then, of course, come back to our website for cghe.usuhs.edu, I think, where you can access information about our courses that are available. A couple of them are virtually available, and so we invite folks to potentially go to those, or just become part of our distribution, and we push out information related to global health engagement.
So looking into the future, when the history books are written 50, 100 years from now, how would you want your legacy in military medicine to be recorded?
I think I'd like to be remembered for building partnership and teams. I think that's so critically important to work that we do in many environments. I often say global health engagement is a team sport. And I think that's something really excited about in my current role, but really in most of the positions that I've been in. It's oftentimes about really kind of building those teams, putting people together, looking for efficiencies. How can we all work together, to get after our goals?
Well, we've been speaking with Dr. Elizabeth Erickson on WarDocs podcast. Liz, thanks again for sharing your experiences and insights with us, and thanks for your service to this nation.
Thank you so much. It's been a pleasure.
Thank you for listening to WarDocs. We sure hope you enjoyed it. WarDocs is a nonprofit organization supported by donations from listeners like you. Please follow and subscribe to our show on whatever platform you consume your podcasts, and rate and review this episode, and share the show with your contacts on social media. Find out more information about our show, our guests, and how to become a member of Team WarDocs on WarDocsPodcast.com. Thank you for your support. If you like war stories and medical drama, WarDocs has you covered. Spread the word.